Good morning. Today we will see the respiratory system. The respiratory system facilitates gas exchange, intake of oxygen, and elimination of carbon dioxide, whereas the cardiovascular system transports the gases in the blood between the lungs and body cells. Failure of either system result in disruption of homeostasis and rapid death of cells from oxygen starvation and accumulation of waste products. In addition to its role in gas exchange, the respiratory system also contains receptors for the sense of smell, filters inspired air, produces sounds, and assists in the elimination of waste. Since nurses are often responsible for the ventilation of patients in a variety of treatment settings, you should understand how the lungs function in gas exchange and know how their structure is optimized for this purpose. Upper respiratory tract contains nasal cavity, pharynx, larynx, above vocal cord. The lower respiratory tract, larynx, it is below the vocal cord, trachea, bronchus, bronchioles, and alveoli. The main job of lungs, as said before, exchange of oxygen, inhaling oxygen and getting rid of carbon dioxide. Normally, when we inhale, diaphragm contract and to hold downward, and the chest muscles contract, expand to open the chest, so it suck in air as vacuum. While exhaling, the muscles relax, the lungs go to normal position and pushes the air out. When you breathe in, air flows to nostril. Nasal cavity, it is lined by mucus. That mucus, it is salty, sticky, and has lysosomes, which are enzymes that kill the bacteria, and the nose is the entrance of nasal cavity. That mucus, it enables to trap the dust and bacteria, forming tiny clumps of gougers. This nasal cavity is connected to 4 sinuses, which are air-filled spaces inside the bone that surround the nose. Frontal, ethmoid, sphenoid, and maxillary sinuses. It helps the inspired air to circulate little bit there, makes it warm and moist. They also act as tiny aqua chamber and amplify your voice. That's why you have different sound when you plug your nose or clog this mucus. So relatively clean, warm, moist air goes from the nasal cavity into pharynx and with throat, that region connectivity, nasopharynx, oropharynx, and laryngopharynx, that is the voice box. Oral cavity is the secondary opening of the respiratory tract, but there is no filtration, no temperature regulation, no humidification occurs there. From there, see, nasal cavity enters, there are the cilia, it works and mucus together, the dust will form as a clumsy goober. Then air goes into the nostril, there will be sinuses above there. It helps to humidify the air, circulate the air little bit there, so humidify the air. Then goes to nasopharynx. Oral cavity also, other entrance of air. It comes there, this is oropharynx. This is uvula. It helps when you eat. It will close here so that food will not enter into the nasopharynx, and it will come here. Here this is epiglottis. This epiglottis called as close the larynx. When you eat food, helps to prevent food cavity goes into the lungs. This one, this epiglottis, spoon shaped, small. It will close here. It will come down and close here. So food will enter into the esophagus. In oral cavity, there is a soft palate behind the hard palate. At the end of soft palate, there is pendulum-like portion, that is uvula. Acts like valve or flap, close the nasopharynx. Often when you eat, entering the food going into the nasopharynx. Continuous of larynx voice box up to the point food and air come together here. Finally, laryngopharynx. Top of this, there is spoon shaped cartilage, that is epiglottis. Here, close like a lid. It will close here the airway, so the food goes into the esophagus and into the stomach. If other than that air gets into larynx, you will have a cough to remove the things out. Air enter into the trachea and bronchus. Air enter into the trachea, bronchus. This point of carina. Left side, left bronchus, right side, right bronchus. This right bronchus is little more straight, left bronchus is little bit transverse. Air enter the trachea and bronchi. At the point of carina, lungs, this one divide as bronchus. Bronchus to bronchioles, bronchioles to alveoli. There are 500 million of alveoli in our lung bed. There is no cartilages in the bronchioles. Bronchioles receive oxygenated blood from the bronchial arteries from the systemic circulation. Alveoli, there is no cilia, no smooth muscles. It has the epithelial cells called pneumocytes. Type 1, type 2, it secretes surfactant. It decreases tension and keeps alveoli to open. Lung bed, we have these alveoli, small. When we come to the lungs have 3 lobes in the right side and 2 lobes in the left side. Left side, superior lobe and inferior lobe, and on the right side, superior lobe, middle lobe and inferior lobe. And also we can divide that one into segments. The right side, superior lobe has 3 segments. Totally 10 segments on the right side and 8 to 9 segments in the left side. The superior lobe has apical segment, anterior segment and posterior segment. And there will be a horizontal fissure in there to divide this one up superior lobe from the other lobe. In the middle lobe, there are 2 segments, lateral and medial segment. And the inferior lobe, it is divided by the oblique fissure. It has 5 segments: superior segment, basal, medial, basal anterior, basal lateral and basal posterior. In the left side, superior lobe has 4 segments: apical posterior, anterior segment, superior lingular, inferior lingular. The inferior we have 4 also: superior segment, basal anterior, basal lateral, basal posterior. This basal anterior sometimes divided into 2, that is basal anterior and basal medial. In some persons we have 9, some they are together, basal anterior only. And pleura is the covering of the lungs. Innermost pleura is visceral pleura and parietal pleura, outer side. Pulmonary ligament is found, double layer of this pleura, visceral, parietal pleura. Between the pleura, a cavity that is filled with the pleural fluid which prevents friction when the lung expands. And there are muscles helps in inspiration also, that is sternocleidomastoid muscle, sternocleido, sternocleidoid, mastoid, sternocleidomastoid muscles. Then external intercostal muscles and diaphragm. Muscles helps in expiration, internal intercostal muscles and abdominal muscles. Here when we see the alveoli, if any tiny particle enter in alveoli, macrophages occurs and push back physically, more it up to bronchus, trachea and cough out or swallowed down. Pulmonary artery capillaries brings deoxygenated blood with endothelial cells, alveoli wall with basement membrane, this one basement membrane. So the alveoli membrane and capillaries membrane separate from each other. Maintain blood gas barrier. At this point, carbon dioxide diffuses to the alveoli and we breathe out, and the oxygen goes into the pulmonary capillaries. So it goes to the pulmonary veins, to heart and to the body. Thank you.